Hello and welcome back to my channel Physio Trends. My dear friends, in this video I am going to show you all how to perform suspension therapy for lower trunk flexion and extension, and that is performed in side lying positions. As you all can see, patient will be in side lying position, supporting the head with one pillow and also supporting the thoracic spine just below the thoracic spine with one pillow, and keeping both the arms comfortably, and this will be the starting position for the patient. Apart from this, we are going to require 4 suspension units, out of which 2 will be double pulley suspension and 2 will be simple suspension. Also, we are going to require this pelvic sling, which is bigger in size so that we can lift the pelvis easily. Also, we are going to require normal sling and 2 ring slings for the ankle. So these are the things which we will be requiring for this, and apart from this, sometimes we might require 2 extra suspension units. Why? That you will see in the video. So to begin with this movement, first thing what we have to do is we have to take a reference point just above the iliac crest. We can palpate the iliac crest on the lateral side over here. Just above that, we have to take a reference point for the line of axis, which I will be taking using this particular rope. Okay, I will be placing it exactly over the iliac crest and measuring which exact cubicle is coming exactly over this iliac crest. This is my reference point. On both the sides, I am going to place 1 double pulley suspension units, as you can see here. So this is double pulley suspension unit. I am placing it over the exactly same line. Once that is done, I am also placing 1 simple suspension units on each side over here. Yes. Now double pulley suspension, it is used. Why? Because it is very beneficial for us if you want to lift some heavy part, and pelvis is a heavier part of the body, and that is why I am going to use double pulley suspension for lifting the pelvis. So here one part I am directly attaching with the pelvis, making sure it doesn't fall. Another side also attaching with the pelvis. It is equally tight. This part I am going to use it for both the ring slings which are attached over the ankle, and one I am going to use it for making sure that both the knee joints are together. So that I am going to use it over here. So all the attachments are fixed. Now the only thing which is remaining is we have to lift the patient up and make patient perform the lower trunk flexion and extension movement. I am going to start it with the pelvic first. So I will be lifting the pelvis with the double pulley suspension unit. Make sure that you are balancing it and lifting it from both the sides equally. Because we have this double pulley suspension, it is an advantage for us that we can lift the patient very easily. So here also I am lifting it, both the sides. Okay, there was a little malfunctioning. Now I can easily lift it up. So as you all can see, pelvis is already lifted from the plinth. Now I am going to lift this knee component. As you can see, knee is also lifted up from the plinth, and now I am going to use this for lifting up the ankle component. So as we can see, the lower part is completely suspended, and now we can easily perform flexion and extension over the lower trunk. So this is the way, my dear friends and physio, we can perform the lower trunk flexion extension movements using the suspension unit. So I hope you all have understood this, that how to perform it. Now also one more thing remains, that how to put it down. So when you're putting it down, you have to go in reverse pattern. Initially you can put down the ankles first slowly, then you can put down the knee joint first, and then we can slowly balancing the pelvis on both the sides and slowly reduce the pelvis height and make sure that it is in contact with the plinth. Once it is at the contact of the plinth, then we can make the patient relaxed. So now I hope you have understood this suspension therapy for trunk, upper trunk as well as for the lower trunk. If you want to know more about the suspension therapy, like how to make this double pulley suspension, simple suspensions, how to do the axial suspension, pendular suspension, anything, you can find it on my suspension therapy playlist. Link I'll be providing in the description, as well as I'll be providing it over here so that you can directly click and go to the playlist. Apart from this, if you have any other doubts related to physiotherapy, suspension, do let me know in the comment section. I will be very happy to answer those and help you out.